Today we are discussing about the class second year BSc Nursing, Adult Health Nursing 1, Unit 4, Respiratory System, the topic Pulmonary Tuberculosis. First, definition of the pulmonary tuberculosis. Pulmonary tuberculosis. Pulmonary tuberculosis is a contagious bacterial infection that mainly involves the lungs but may spread to other organs. An infectious bacterial disease characterized by the growth of nodules, tubercles in the tissue, especially in the lungs. Once again, definition of the pulmonary tuberculosis. Pulmonary tuberculosis is a contagious bacterial infection that mainly involves the lungs but may spread to other organs. An infectious bacterial disease characterized by the growth of nodules, tuberculosis in the tissue, especially the lungs. Second, causes and etiology. Pulmonary tuberculosis is caused by Mycobacterium tuberculosis. Pulmonary tuberculosis is caused by Mycobacterium tuberculosis. By air droplets, coughing and sneezing, by close contact with infected persons. Then risk factors: malnutrition, excessive alcohol addiction, immunosuppressive clients, poor health, children under 5 years of age, smoking. Risk factors: malnutrition, excessive alcohol addiction, immunosuppressive clients, poor health, children under 5 years of age, smoking. Then stages of tuberculosis. We have to divide it 3 stages. First one is the primary stage, second latent stage, third active stage. Primary stage, latent stage and active stage. Primary stage, people with weak immune systems show symptoms 1 or 2 weeks after the microorganism enters the body called primary infection. Primary stage, people with weak immune system show symptoms 1 to 2 weeks after microorganism enters the body called primary infection. Then second, latent stage. Bacteria may also be absorbed by macrophages or WBC, white blood cells, and such bacteria can persist inside the macrophages and remain dormant for years. No symptoms and not communicable. Latent stage. Bacteria may also be absorbed by macrophages or WBC, white blood cells, and such bacteria can persist inside the macrophages and remain dormant for years. No symptoms and not a communicable. Active stage, third one is the active stage. Whenever immune system weaken, bacteria will multiply and make you sick. Shows symptoms and communicable. Active stage, whenever immune system weaken, bacteria will multiply and make you sick. Slow symptoms and communicable. The pathophysiology, fourth one is the pathophysiology of the pulmonary tuberculosis. Due to any cause, example droplet nuclei, then etc., leads to the bacteria transmit to alveoli, deposit and multiply. Then leads to the body immune response stimulates. Body immune response stimulates and leads to the macrophages come and destroy many bacteria and normal tissues. Macrophages come and destroy many bacteria and normal tissue. Leads to the dead bacilli and live masses surrounded by macrophages. It means causes tubercle. Dead bacilli and live mosses surrounded by the macrophages leads to the necrotic degeneration occur. production of cavity filled with cheese-like mass of tubercle bacilli, dead WBC and necrotic tissue leads to the cause pulmonary tuberculosis. Once again, pathophysiology of the pulmonary tuberculosis due to any cause, example droplet nuclei, then leads to the bacteria transmits to the alveoli, deposit and to multiply, leads to the body immune response, stimulates, leads to the macrophages come and destroy many bacteria and normal tissue, leads to the dead bacilli and live mosses surrounded the macrophages like Conn's tuberculosis is called as Conn's tubercle. Then leads to the necrotic degeneration occur, production of cavity filled with cheese-like mass of tubercle bacilli, dead WBC and necrotic tissue leads to the pulmonary tuberculosis. Next, signs and symptoms of the tuberculosis. Long-term cough more than 3 weeks. Next, blood in the cough, hemoptysis. Then fever, chest pain, breathing difficulty, chills, night sweat, loss of appetite, weight loss, weakness and fatigue. Signs and symptoms: long-term cough more than 3 weeks. Blood in the cough means hemoptysis. Then fever, chest pain, breathing difficulty, chills, night sweat, loss of appetite, weight loss, weakness and fatigue. Diagnostic evaluation, physical examination, history collection, X-ray test, presence of the X-ray findings shown. They have the presence of nodular patches is present for the X-ray. Then sputum test, presence of acid-fast bacilli, AFB. Presence of, if the sputum is testing, they have the presence of acid-fast bacilli is present. Then Mantoux test, tuberculin injected with the intradermally, Mantoux test. Then blood test WBC increased during the infection, ESR is elevated. ESR, erythrocyte sedimentation rate, may be expected in children with tuberculosis. This is the diagnostic evaluation of tuberculosis. Next, medical management. Some tricks, ripe sketch okra means they have to another first line drugs, second line drugs, newer agents. They have to divided 3. First line drugs they have to rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Once again, first line drug is the rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Then second line drugs, kanamycin, ethnomide, para-amino-salicylic acid, then thiacetone. Second line drugs, kanamycin, ethnomide, para-amino-salicylic acid and thiacetones. Then third, new agent drugs, ofloxacin, ciprofloxacin, clarithromycin, rifabutin and azithromycin. Newer agent medicines, ofloxacin, ciprofloxacin, clarithromycin, rifabutin and azithromycin. Medical management of the pulmonary tuberculosis. Next, DOTS, directly absorb treatment short course. The full form of DOTS, directly absorb treatment of short course. DOTS is a strategy used to reduce the number of tuberculosis cases, TB cases. In DOTS, healthcare workers observe the patients as they take their medications. Isoniazid, rifampicin, pyrazinamide, streptomycin daily for 2 months. They have to observe DOTS. DOTS directly absorb treatment for short course. Then, thank you.